What makes a Systems 4 PT evaluation so much faster? Based on your clinical judgment, prior encounters with the patient, and updated evidence from today's encounter, Systems 4 PT recommends an average 1,250 patient-specific, MIPS-specific words without typing or dictating. When you open the evaluation, you see that patient concerns, pain, prior level of function are recommended. You don't document any of this. You review this information prior to meeting the patient. Systems 4 PT technology details the outcome test and the score. Based on your clinical judgment, we document the functional deficit and the therapist forecasted ending severity. Work status is documented. Medical history is detailed, including a BMI cue to verify the BMI rating, and notice that the patient is a falls risk. Note that with BMI and falls, the system cues the therapist to have the necessary MIPS-related conversations with the patients. Finally, medications are documented, including dosage, frequency, and route of intake. Based on the therapist's clinical judgment, coding rationale is recommended in the blink of an eye. As you know, the CMS requires the therapist defend the complexity of the eval code. Why is that eval code moderately complex, not mild? Why is the eval code highly complex, not moderate? Remember, just because you're required to include this defensive documentation with every evaluation doesn't mean that it's your job to type it. This is the future of EMR. Systems 4 PT recommends the assessment to the therapist, and if the patient is a diabetic being treated by a PT, we input the lower extremity neurological exam and footwear overview automatically. The therapist is cued to be compliant with MIPS. Driven by the functional deficits selected by the therapist, our technology recommends functional goals. Any of this can be edited by the therapist. Systems 4 PT defends the clinical rationale for every exercise, treatment, and modality in the flow sheet relative to the diagnoses, relative to the deficit selected by the therapist. Touch-free. The therapist then edits and supplements the recommended documentation. The therapist documents objective findings, special tests. This is how you can document a Medicare evaluation in 12 to 20 minutes that's more compliant than how you document today. An average 1,250 patient-specific, MIPS-specific words recommended without typing or dictating, versus checklist EMR, where the therapist snips together 2 or 3 words at a time to document a 1,500-word evaluation. Versus checklist EMR, a technology will save you 33 minutes. If you're a slow typist, we'll save you 31 minutes. If you're an average typist, we'll save you 24 minutes. These 1,250 recommended words will save you 14 minutes, even if you're a really fast typist. And rather than stay late at work to dictate your eval, we'll save you 10 minutes versus dictation. And remember, you save this time with every evaluation. Systems 4 PT is the undisputed fastest EMR. We're specific to outpatient rehab. Our company is 17 years old, used to process over 20,000 patient treatments every day. While the other 2 leading EMRs are owned by venture capital banks, Systems 4 PT is owned and managed by our founding management team, profitable, in control of our own future. We integrate scheduling, outcomes, MIPS submission, management reporting, billing in one single database. And we provide this for less than you pay today for your slow, outdated EMR. We invite you to take back your life from slow EMR. We invite you to take back your weekends. Rather than spend your Sunday afternoon documenting, spend it with your family. We urge you to remember, your job is not to write books for Medicare. Your job is to restore the patient's functional deficits. We invite you to experience the fastest EMR in outpatient rehab. Document an evaluation on your own computer, at home, at work. Ask for a hands-on demo where you'll experience the future of EMR firsthand.